Good morning, everybody. Thank you so much for joining today's session. My name's Mel. I'm the Quality and Process Audit Manager here at Care First. Today's session, we're going to look at the science behind social distancing. And the reason why we thought that might be important to look at is obviously in the UK, recent changes have been made to reduce the social distancing to 1 metre plus. And we thought that there might be, some confusion around why that might be. So we thought it might be helpful to look into some of the science behind that decision and what's gone into it. Just some housekeeping then for today's session. Everybody is in listen-only mode. I will run a Q&A at the end of this session, so if you have any questions at all throughout, please feel free to type those in the questions box on the right-hand side of your screen, and we can go through those, maintaining confidentiality, obviously, with those questions at the end of today's session. So it's also important to highlight that I am by no means a scientist, but the content for today's session was originally published on The Conversation. I will share some useful links and information sources with you towards the end of today's session, but the content that we're looking at was provided and written by an associate professor in environmental engineering, so certainly the person that would be in the know to talk about this topic. Okay, so just to start off, so what constitutes as a safe social distance when it comes to the spread of COVID-19? And the answer really depends on where you live. So in China, Denmark and France, they recommend social distancing of just 1 metre, whereas Australia, Germany and Italy, they recommend 1.5 metres. And in the US, they recommend 6 feet, or that's equivalent for those of metrics of 1.8 metres. So whilst the UK here has obviously recently announced that it's going to relax its social distancing guidelines to a minimum of 1 metre plus, where 2 metres just isn't possible. So the truth is that we don't yet know how far is far enough when it comes to coronavirus. And there's been a couple of studies conducted recently. One of them was by the Centers for Disease Control and Prevention, or the CDC. They found that the virus was in air as far as up to 4 metres away from infected patients in a COVID-19 hospital ward. But then in another study that's published by The Lancet and that has been backed by the World Health Organization, or the WHO, they concluded that the risk of transmission becomes significantly lower with a physical distance of 1 metre or more from an infected person, and that's compared with the distance of less than 1 metre. And that reduced further, obviously, with the increased distance that you had with an infected person. And, we want to ask ourselves, why is there such a range of safe distances? Why are there these differences between different countries? And, why is everybody doing things differently if it's the same virus? And the answer to that is social distancing is a really complex problem, and it's got many variable influencing factors. So throughout this session, we're going to go through what 4 of those key influencing factors are going to be. So just to cover off what today's session will cover, obviously those 4 influencing factors that have to be considered with social distancing. That includes respiratory droplets, it considers viral load, infectious dose, the environment, and we're also going to look at complex scenarios, because it's important that we consider those in how they can affect any one of those 4 considerations, really. And we also think it would be important just to cover off the support that is available to you from Care First towards the end of this session. And as I mentioned at the start, we will also go to a live Q&A at the end if you have any questions at all on the Care First service or any of the content that we've covered today. Okay, so just to start off with the first kind of influencing factor really that we have to consider with social distancing, which is respiratory droplets. So when we breathe, talk, cough and sneeze, thousands of droplets are expelled from our mouth and from our nose. The size of those droplets vary. Some may be millimeters in size, and some of them might be many thousands of times smaller than that. The larger droplets, which carry more virus particles, they settle more quickly because of gravity. And the smaller droplets carrying fewer particles, they can remain suspended in the air for hours. And the number and the size of droplets can vary depending on the activity. So a cough, for instance, produces more droplets overall, and a greater proportion of them are larger, whereas breathing obviously produces fewer droplets overall, and they are generally smaller in size. And the speed in which the droplets will leave your mouth and nose also influences just how far those will travel. And sneeze droplets, for instance, will travel the furthest because of the force and the speed that they leave us. So it's also important that we look at the second factor, which is viral load. And viral load refers to the number of copies of the virus in a sample. So, for example, in the droplets that leave our mouth and nose. So we know that the number of virus copies in the respiratory samples of COVID-19 patients can vary from a few thousand to hundreds of billions per milliliter. It's really vast. And the viral load varies from one person to another. But it also depends on what stage of the illness that patient is at. So we also know that people without symptoms, they can shed the virus as well. And that's the crucial part. That's the key point, is that you know, we need to be maintaining social distancing even when you don't have symptoms, because if you're asymptomatic, you know, you could be spreading some of those particles without even realizing you're doing it. So it's so important that we maintain social distancing and keep to those guidelines as best as we possibly can. Also, knowing the viral load in respiratory droplets, it allows us to calculate how many virus particles people may be exposed to and whether that might be enough for them to become infected. And then looking at the infectious dose. So the infectious dose is the number of copies of the virus that your body needs to be exposed to in order to develop an infection. So when it comes to calculating a safe distance, the closer that you are to an infected person, the more likely you are to be exposed to the infectious dose by breathing in those droplets and you're containing the virus. The infectious dose for flu or influenza, for example, those strains vary from thousands to millions of copies, and we don't yet know what that number is for COVID-19, or specifically for the SARS-CoV-2, the specific virus that can cause COVID-19. We're not sure what that number looks like at the moment. Obviously, in time with the amount of research that's happening at the moment, and looking at how the virus behaves in humans or other animals and comparisons to other viruses, all of those things will help us to specify what that number looks like. In any case, we can just be certain that the infectious dose is going to vary between people to people, and how they carry the virus, whether they're asymptomatic or whether they are experiencing symptoms. Everybody will carry very different levels of infectious dose. So the last influencing factor then is the environment. So this is a really important one. So whether we are indoors or outdoors, whether we're at school, at work, or on public transport, or in the supermarket, for instance, the flow of air in those environments and the ventilation, the temperature, the humidity, all of that will influence what happens to our respiratory droplets. Air currents will blow droplets around in various directions, and good ventilation will dilute the number of droplets in the air. But another factor to consider is that temperature and humidity will affect the rate at which the water evaporates from those droplets. And all of that will affect our understanding of how much distance to keep in different types of spaces. And that might be changeable from the guidelines that we are given today and that we're adhering to right now. So the more research that happens, obviously, around environmental changes and how that affects the rate of infection in different types of spaces, the guidelines may be subject to change due to that. So with those four influencing factors in mind, it's important that we also pay attention to the fact that we can't possibly apply one rule to all situations. With those four elements in mind, we can try and put together what makes a safe social distance, and give us a slight understanding really in terms of how government and advisors may have come to that decision to give us a guideline of 1.5 meter plus. So if we start with a complex scenario, just as an example, so if we start with this scenario, so there's 3 people in a room and that room is not ventilated. One of them is infected and 2 of them are not. If one of the healthy people is standing closer to the infected person, so for example, if they're stood 80 centimeters away, for example, and one of them is further away, say 2 meters, the infected person coughs, they produce a cloud of droplets in that space. The larger droplets carrying more of the virus particles settle more quickly because of gravity, as we said, but the smaller droplets carrying less of the virus travel further. So the person that's standing closest to the infected patient is at a higher risk of being exposed to infected droplets, obviously, than the one that's standing further away. Now, obviously, that scenario is overly simple, and there are other factors that we need to consider with this. So, for instance, people moving around in a space, an open window, it might blow air in a particular direction. The infected person may cough repeatedly during that period of time, and obviously pushing the virus particles around. An air conditioner might recirculate air around a room. Exposure to many smaller droplets over a longer period of time might then be equivalent to exposure to a few larger ones in a shorter period, for example. And what we need to recognise is that there is an infinite number of scenarios, and as we said, just having one rule that applies to them all at this stage is impossible. And that means that different countries' guidelines, they're made on the basis of some of those factors that are described. So they can't apply in all contexts, which is why different governments in different countries have obviously taken different stances of how they're interpreting that research and that information, and how they want to apply their social distancing rules. It's less likely that you would be exposed to infectious droplets outside because you've got that rapid airflow and you've got that dilution, but an enclosed, crowded indoor space are much more at risk. And that's obviously why we're seeing now with those findings why the use of face masks is going to be important from the 24th of July. So it's really important that we all do our bit to stop the spread of coronavirus. So, please try and keep your distance as far as you possibly can. So hopefully you found that bit of science useful around social distancing. As I mentioned at the beginning, the information source for the content was originally published on The Conversation. So if you wanted to access that information in a bit more detail, I've included the link here below. And the author of that was Lena Siric, who's Associate Professor in Environmental Engineering at UCL. I've also included some links here for those two studies that were completed, one by the Centers for Disease Control and Prevention, which talked about those findings in the hospital ward, COVID ward, of 4 metre findings of the spread of the virus. And I've also included the study that's published by the Lancet and that was backed by the WHO, that kind of reassured us that the 1 metre findings is the safest social distance for which the virus doesn't spread. So if you wanted to have a look at those studies in a little bit more detail, then of course you're welcome to use those links to look at that in a bit more depth. I've also included a link here as well for the social distancing guidelines on .gov. It's really important to highlight that obviously right now the advice for the UK is 1.5 metre plus, but it's always important that you consider what the guidelines are and restrictions may be for your particular area or region. So please do always refer to that when you're looking at making any changes to what you're adhering to at all with what's gone out in our guidelines. So I also thought it would be important to just touch upon the Care First service and what's available to you from us. So hopefully you've all at least heard of the service before, but for those of you that haven't, we're a professional counselling, information and advice service. We offer support for absolutely any issue, whether that be arising from work or from home. And we fully appreciate at the moment that for many of us, those are one and the same spaces. So if there's anything that's causing you a stress or a worry, please do give us a call and get some support in the moment. So the counsellors are available 24/7, 365 days of the year, as I said, to help support with anything that's causing you a stress, a worry or an anxiety. And in that first call, it's really important to point out that from the minute you speak with Care First, you're speaking with the people that can support you right away. They can help you in the moment through whatever it is that's causing you a stress or a worry. And they will just establish really what the best way forward is going to be for you. They will assess what the presenting issues are. They may support you in that moment through what's going on for you that day. And that may be all that you need. Or they may consider in that call or in any subsequent calls that you make to the service that you may benefit from having a few more contracted sessions, which can either be provided over the telephone and in some cases face-to-face. You also have access to an information service as well, and that's really important because it's not always the emotional things in our lives that cause the most stress, worries or anxieties, but it's the practical things as well. You know, perhaps you are worried about a return to work and, you know, what the social distancing guidelines might mean for you. You may have been financially impacted by COVID-19, or you may just have some general inquiries around legal information, employment, childcare, housing, financial issues, anything at all like that that you would use the Citizens Advice Bureau for. You can use the information specialist services for. They're available 8 AM till 8 PM, Monday to Friday. They are all Citizens Advice trained staff, and they have access to the same information and databases as you would do with the CAB. And obviously with that availability, you're speaking with people in the know with certain specialisms that can help you with any practical issues and help put you back in control of a situation again, because often it's that loss of control that makes us feel that you know, things can be spiraling out of control. And just having that information again can help put us back in control of a difficult situation. The information specialists are also able to put you in contact with a counsellor as well. So if they recognise that there's some emotional elements going on for you with a practical issue, they may suggest it beneficial for you to get support from a counsellor, and those services complement each other really well, so it works vice versa. So if a counsellor recognises that you have some practical elements going on in the issue that you're calling with, they can arrange for an information specialist to get in contact with you to provide that support. I'm also going to cover off as well the online counselling facility. So you have access to the Care First Lifestyle site through your provision. The Lifestyle site is an excellent hub of resources and information. If you want to learn a little bit more about Care First and what we do, or if you want to read up on the issue that you're thinking of phoning with, this is a really great space to do that. And you also have access to online counselling in real time with a counsellor that's available through your provision as well. The other aspect of the service you have access to is a management support service, which is support for managers on how best to handle a difficult situation or how best to manage their teams. It might be that they need some advice on how to handle an issue like absence management or a disciplinary. Perhaps they need some advice on how to support their staff throughout COVID-19 or working from home. Or perhaps you have a member of staff who's gone through a bereavement and they come to you for some support. The management support service can really help you maintain your managerial boundaries with those employees and how best to support them through some difficult times as well. And then lastly, just to touch upon the confidentiality of the service. So if you take anything away from today's session and this piece on Care First, is to know that the service is 100% confidential. Nothing that you say to Care First can ever identify you within your organisation, and no information is ever passed back to any third party at all. That is with the exception of these three really exceptional circumstances, which I'm sure you can appreciate, is the threat to life of another person, child protection and vulnerable adult issues, and the risk to the security of your organisation. But please be assured that the service is 100% confidential and you cannot be identified as having used the service. Okay, so I hope that you found that session useful. If you wanted to contact the service at all, the number that you need is available from either your line manager or your HR department. They will also be able to provide you with your online details to access the Care First Lifestyle site. Unfortunately, I can't share those with you today because every organisation that we support has different access and has different information to access the services as well, so that it will be available from your organisation through your HR department. I hope that you found that session useful. Obviously, we've covered off some of those 4 elements of the science behind social distancing, also looked at some of the complex scenarios that we need to consider, and just really highlighting the importance of trying to keep your distance. You know, obviously the government guidelines are saying 1.5 metre plus, where 2 metres aren't possible, but the reality is just try and keep a safe distance as far away as you possibly can, and to be wearing your mask from the 24th of July. So I hope that you found that session useful. Thank you so much for joining.